It is a pleasure and honor to host Dr. Zulia Frost today to talk about red light therapy. She's an expert in this area and a clinician renowned for her use and research of neuromodulation, bioresonance, and photobiomodulation. And she'll explain what these big words mean in our podcast. She's also a doctor of general medicine and pediatrics with postgraduate training in ultrasonic diagnostics and radiology. And what's even cooler is that Dr. Zulia is also a doctor of traditional Chinese medicine and acupuncture. So she is really, really well rounded in so many ways. And when she saw with her own eyes the high rate of success in her patients relieved from pain and regaining function while using photobiomodulation, she decided to pursue her vision for this advanced technology to become a standard of care in every home. So she co-founded the company Recharge and now works as the clinical director, dedicating her efforts in promoting red light therapy with a device called FlexBeam. And when I heard about Dr. Zulia and her expertise in red light therapy, I had to invite her to be a guest speaker in the Menopause Energy Reboot program, which we just finished as a cohort last month. And I wanted her to share more about the benefits of harnessing red light from both nature and devices. And she was so thorough, and everyone in the program was so blown away. So I'm really excited to now share her with you too. And now for the fancy disclaimer. We will be talking about all kinds of benefits and therapies using red light, but also about the FlexBeam, which is currently sold as a general wellness device only. The information provided should be regarded as a general guidance about FlexBeam and its uses. Dr. Frost and Recharge make no declaration about the safety or effectiveness of FlexBeam and does not claim to diagnose, treat, cure, or prevent any disease. Using FlexBeam is not a substitute for a consultation with your healthcare provider. Information given should not be construed as medical advice. Got that? So now, without further ado, let's meet Dr. Zulia. Welcome.
Thank you so much, Dora, for inviting me. I'm delighted to be back speaking with you, and I really, really look forward to enlighten people about red light therapy.
Enlighten. I love it. You are going to enlighten us in so many ways. But we're going to cover three concepts that red light therapy supposedly helps with: pain, skin health, and the gut. But before we dive into all those amazing things that it will help, but let's take a step back and just explain what those three areas of expertise you have that I mentioned in the intro: the neuromodulation, bioresonance, and photobiomodulation. What does this all mean?
Yes, it does sound really sort of scientific and jargonist, I would say. Basically, these concepts of using energy devices, energy in the body, and stimulating particular different aspects of the body with the neurostimulation. You stimulate the nervous system. The concept of they're using devices on the skin surface where the nerve endings live. And so when you stimulate the nervous system, you get sort of feedback response from your brain, and thus you modulate responses by stimulating the skin. So effectively, you could apply this stimulation in a very similar way to just general optimization of the body function. So there is an element of bioresonance. Bioresonance concept is a little bit more difficult to describe, to say if you don't really know physics, but I will just very quickly introduce this concept. So there are some vibrations happening in the body on a cellular or even molecular level, and these vibrations are rhythmical. And so in our body, we have different degrees of different cells vibrate with differently. So if you apply energy devices and you hit the vibration, the rhythm of vibration, you can amplify the function, or you can opposite, you can cancel. And this concept is used, for example, to use frequency modulation devices to for example, destroy viruses, destroy parasites in the body. So because you hit the resonance, but you cancel this wave. In this case, you energetically destroy pathogen. But at the same time, if you hit the resonance and you amplify the wave, you can actually transfer energy from the device into energy of your body. And by doing so, you optimize again energy reserves in the body and function. And of course, photobiomodulation, it comes to the same aspect of creating better environment for the body to heal itself. With photobiomodulation, photo means light, bio means our biology, and modulation, it means you can operate, you can change the function of the body in terms of energy to improve the energy in the body by stimulating with light. But this is just the beginning, because when scientists start looking further and deeper into all this aspect, they found you can apply to tune and modulate variety of functions in the body, not just limited to energy. So I'm hoping today to a little bit discuss more in details, particularly photobiomodulation.
Wow, I'm really excited. It's amazing. Bioresonance, to me, I have to learn more about that too. I mean, to be able to attack viruses without a drug or some medication is quite amazing, and I think that would appeal to a lot of people. So the photobiomodulation, is that red light therapy, or is that an umbrella term? And what is red light therapy?
It's exactly right, Zora. This is umbrella therapy, because light also can be used with the strong sources. In this case, light could be, thermal lights. It can cauterize, and it's actually used in mainstream medicine by surgeons to cauterize blood vessels when they do surgery, so blood doesn't leak. But for this, they're called thermal or hard or very strong energy lasers or light devices. So photobiomodulation or photobiostimulation comes to the opposite term, using light in the very small doses, just enough to stimulate the cell or the cellular level. So the energy is very low. It's often referred as a cold light therapy or low intensity lasers, for example, or low intensity light. So this particular branch of medicine dedicates to studying of light in small doses, which kind of tuning the body, and particularly tuning the energetics of the body. So this is photobiomodulation, and it normally concerns light in the visible spectrum, like what we see, perceive with our eyes, like green, blue, yellow, red, but also two aspects, UV, which is close to blue light, ultraviolet, and near infrared or infrared, which is close to red spectrum. So you kind of cover all the spectrum under photobiomodulation. And of course, red light is a subset which is dedicated specifically to use of red spectrum and infrared spectrum. So it's commonly called red light therapy.
What's the difference between red light spectrum and infrared light spectrum?
The difference is in the wavelengths, how long they are. So the scientists refer it to nanometers, how long the wavelengths. The further you go in spectrum from red into infrared, the longer the wave. So for example, red light would be sort of between 600 to, let's say, 700, yes, nanometers. Typically, most studies, nanometers for red light is 600, 625, 615, 635, 650, yeah, nanometers. But then further you go, you start coming to infrared spectrum. And the first part of infrared spectrum, also referred as infrared A, so called near infrared light. Near infrared light operates sort of approximately 800 up to 1000. And then you have this further longer spectrum B. So 1000 to 2000 or 3000 even. And then it goes into far infrared. So mid-range and then far infrared. And far infrared, anything longer than 3000 nanometers. So much longer wavelengths. And they generally harmless. The longer the wavelengths, the more safe they are.
Okay. So yeah. So then the far infrared would be better than near infrared for the body.
Uh,
Let's say
Not
you're
necessarily.
talking about the body and healing and the gut and skin and all that. What's better?
Yeah,
Not near, far, or
this is a good question because what we need to know, we always need to identify the goal. What are we trying to achieve, right? So, for example, the mechanism how the body absorbs light will be different between near infrared lights and far infrared lights. Yes. So in a way, we just have to accept the concept that we are, human beings being on the planet like anything else on the planet evolve under the sunlight. So these light wavelengths, our body learn evolutionary to harvest in different spectrum, like in some cells absorb light in blue spectrum, some cells in green, some cells in red, some cells in near infrared better absorb, yes, but other cells may not absorb it. So the mechanism is very different. So when we talk about the infrared lights, it's primarily absorbed by the water molecules in our body. So our water body likes that energy in these nanometers of wavelength. So therefore you get this energy passed straight away to this water. So you get this heating effect. Yes, that is used now in saunas. Yes, so you go into infrared sauna, and it's maybe it's cold, but inside your body you become warm. You become even sweating. Same infrared heaters work on the same principle. But when we talk about near infrared lights, the absorption happen in this spectrum, 800 to let's say 880, 850 typically. Absorption happen by cellular organelle mitochondria. So you directly stimulate with light without heating the body, without thermal effect. And you stimulate production of the energy on a cellular level. So if you go to energize the body, yes, the infrared light is better for you. And if your goal is just to get warm, for example, or heat up the tissues, because you need for some therapy, like, for example, one aspect of treating cancer, they use hyperthermia. You need to get the body really warm to activate the immune system. So you can use infrared light for this. So mid-range, far-range light would be better.
Oh, wow. Interesting. Okay. So it depends. The answer is it depends on what you're trying to treat. So if you're looking at sort of a home device, then the near infrared is the better way to go. If you're looking to really treat cancer or some other problem, then you go see a doctor or a clinic, and then they would probably use the far infrared. Did I get that correct?
Yes, yes, not necessarily treating cancer, but again, assisting
Oh.
the body to produce healing response reactions.
Mm. So to go back, just to reiterate to make sure we understand, then infrared light is the kind of light that is on the a bit farther away from that midpoint section that you said about 600 is sort of that's the light. And there's many different spectrums of light, many different colors. But when we're talking about red light, we're talking about just one end of the spectrum, and that goes from 800 on up. And that would be infrared light therapy. Is that correct?
Yes, it's already infrared, but it's a near infrared range.
Yeah.
And then
Yeah.
you go further into mid-range and then far infrared range.
Mm-hmm.
They all have a beautiful therapeutic property. I mean, I've got at home infrared sauna. I love it. And especially when I feel I'm about to get ill, I can just jump into the sauna and my body receive this infrared. My molecules are happy, they isolate and energized, and my body fights the infection better.
Yeah. So if anybody's stepped into an infrared light sauna as opposed to the traditional, I don't know, Finnish sauna that's hot and you can only sit there for 10 minutes or so when it's really hot. An infrared is not, you don't feel the heat. You feel, it's maybe a little bit warm, but it's nothing you can handle. People sit in these saunas for like an hour. And that's where we're getting a deeper level of, it's a different type of sauna, and you're reaching at a cellular level the benefits, as opposed to just exterior, maybe the sweat. And there's a lot of other benefits. I don't want to poo-poo Finnish saunas, but it's just different, right? So yes,
exactly.
So then red light therapy is the umbrella term for infrared. Is that correct? Is there no other just red light therapy that does not include infrared? Does that make sense?
Typically, it's referred to covering both red and near-infrared spectrum of light. But there are some devices which produce just red lights, then they will be red light therapy devices, especially used in aesthetics a lot nowadays.
Oh, so then okay. So then that would be more in the 600 or around spectrum. I see. Okay,
exactly.
So that when we go get to a salon and they do some laser treatment on our face, that may be red light, but not infrared light.
Yes. Or could be they run first red lights, and then next 10 minutes they run infrared lights separate. But even if it's just red light, it would be referred as red light therapy.
Okay. Thank you so much for clearing up the confusion. The terminology, it can be so confusing. So are there any other benefits? I mean, so to the other spectrums of light, you mentioned blue and green and yellow. Are those beneficial to the body too?
Of course they are, because it's a way how our body harvests energy. As I said, sun is the ultimate source of energy on the planet, and we are part of it. We are completely, integral part of it. So our body to learn how to adjust and how to live in receiving this energy. So yes, for example, with the green spectrum or blue spectrum, what the best to absorb is the red blood cells, like hemoglobin, absorb light better in this spectrum. So you can potentiate your oxygen binding processes in the body using this spectrum of light. Another thing is that for example, white blood cells are the most susceptible to red light or near-infrared light. Yes. So you have the combination. You can use the variety of light to potentiate body responses. But scientists find very interesting. It's not just limited to specific cells. Light could actually stimulate certain enzymes, complexes in the body. So they were still learning. For example, I read one scientific article about using green light to help patients with diabetes. This is something is really excitingly developing right now. All this photobiomodulation industry is just so much to offer, and considering that there are no side effects, it's because it's just mimicking the natural sunlight.
That's what I like to hear, is this no side effects, and it's perfectly safe, and that's amazing. So we know that red light can be experienced with a sunrise and a sunset. So how do they affect our health, and how long do we actually have to sit in there in the outdoors to get some kind of benefits in the body?
Well, it is believed that red light stimulates your optical pathways, basically stimulates production of melatonin. And I know, because I read this even in the early days of me being curious about yogi practice, when the yogi would sit and watch sunrise or watch sunset. It's ultimate exposure to red spectrum of light, because sunrise and majority of the sun spectrum, it's within this red light. And so it is known that when you stimulate pineal glands, you produce more of the melatonin. And everybody thinks of melatonin as, things which you take when you have a jet lag and, helping you to sleep. But it's much, much more to it, because melatonin is a principle orchestrator of the circadian rhythm. So how your body is functioning according to certain time of the day. And we also know that nowadays we just so screwing up with the circadian rhythm. So there are some problems with people falling asleep, or these people stay late way before belong sunset. So this melatonin is also very important for regulating the circadian rhythm. And melatonin is also a powerful antioxidant. And now more and more, even, functional medicine scientists, they say, well, we love our glutathione as antioxidant, but we love melatonin more because it stimulates this antioxidant property, protective property on the cellular level. So red light, exposure to red light and sunset, sunrise is actually giving you health benefit. But in your question, you said, should we all sit and watch sunset, sunrise? And said, yes, by all means we should, but could we? I mean, our lifestyle nowadays, we just, we have to work. We have to get up and go to work. And there is no really you, maybe on holidays, you can sit and watch sunset, sunrise. So that's why the manufacturers bring into on the market the devices, so you can actually use and help yourself and use it at your own time, in the morning or in the evening.
Yeah, it mimics the sunrise and the sunset, so we can bring it into our home. I'm wondering, some people who've been following me, I try to get to the beach as much as I can and watch a sunrise or sunset, and you see my skin is all orange. I mean, this is the red light. And so, but I'm wondering if people were to live in a city and say they want to get, they want to get a bit of a sunrise. I don't know, can you just sit there for 10 minutes and absorb that red light into your eyeballs? Would that be enough to sort of set a little bit of the circadian rhythm and the melatonin?
You need to do it as like a course of treatments, I would say. So even if you greeting sunset or sunrise, it can one time is just not enough. You really need to have a regular, either you live by the sea, I mean, who fortunate to do this, but most people live in the cities, and most of the time they shield it with light with the big skyscrapers, and so it's just practically not often possible.
So you really need to have an open sky. You couldn't get just a little bit of sky in between and expect to get some red light benefits.
Another thing which I learned actually through using through the FlexBeam, that not necessarily you have to receive these red lights through the eyes, because I believed before it only exposure your eyes will give you production of melatonin. No, not necessarily. So if you use specifically near infrared spectrum of light on the body, anywhere on the body, it will give you same effect, because near infrared lights also can be produced subcellular in the different cells of the body, not necessarily by pineal gland. This is a very latest knowledge.
Oh, wow. Okay. That's good news. So
totally.
Yeah, so these devices are quite amazing. When was the first red light therapy device made and then put on the market? And, is this such a new concept, or has it been around for a while?
Oh, yeah, it's been around, I would say, let's look at the very ancient time when, heliotherapy, they call it, or therapy with the sun. Ancient people used that. We used it. I mean, I know from history of medicine, it's been used to put people with tuberculosis, for example, to lie in the sunlight to get health benefits. But really, everything sort of kicked in 60s. 1960, the first device was produced by Mayman, the scientist, American scientist. And then Mester will produce 1961 first ruby laser device. So that's why at first it was concept of photobiomodulation just prerogative of low level laser light therapy, LLLT, if you look abbreviation. So it all was carrying on until sort of mid-90s, where LEDs was developing in parallel, yes, but they were so inefficient, they were so cumbersome, so nobody paid attention to this. But lots and lots of research has been done in lasers in sort of 60s era. I myself received the first, I was a student in the medical school, and I had a nasty accident, ski accident, massive hematoma in a wound. And my fellow student used actually laser on me then, that would be mid sort of 80s. Yeah, he used laser to treat this hematoma. And, it was very successful. And I was already exposed. And my teacher of surgery was one of the first people to use laser in clinical medicine. So I'm really fortunate with that. But really for LED technology, if we talk about sort of expansion of photobiomodulation, started with lasers, but now LEDs come into to the market to play. It was all started with NASA research into plants. Could plants grow in space? Yes. So they start using red lights, and they saw improvement in the growth of the plants. But someone accidentally, so it's like a happy accident, was exposed to red light and noticed that the wound on the hand was regenerating crazy speed, very, very fast. So they said, maybe something in it. And then NASA launched some physiological study on this subject. And because NASA is such a respectful institution, since that time, everybody started saying, maybe something is in it. Yeah. And so people start investing and researching more of this photobiomodulation. Well, I would say year by year, 2012, 2008, when they first did research in mitochondria, and they said, wow, it does affect mitochondria. 2012, where this started to expand into creating panels, which give you, the general systemic effect, and so on. And of course, aesthetics was extremely, but aesthetics more focused on red light first. And red light entered the medical world through dermatology, because you can then use it on the skin, on the wound, on the eczemas, on the potentiating, making the collagen beautiful, collagen structure of your face, so you don't have saggy face, and etc. So it's all kind of came that way, but it's no way stopping. It's now exponential growth. It's in the last 3 years, 4 years, I would say, they researched like not only triple, 10-fold increased.
Wow.
And yes, it's really booming now.
It is. And you see these devices popping up everywhere, and it can be really confusing which one to get. Are they safe? What should we look out for? So if somebody's shopping around for a red light therapy device, what should they look out for? What are the key points?
Well, first of all, I always like people to identify what they buy this device for. Like if they buy for aesthetics, you need to look primarily into the red lights, because red light, the difference with near infrared, it's absorption level. Yes, so red light typically absorbs within the skin level. Near infrared light goes through the skin all the depth. It also has benefits, yeah, because it would stimulate the blood flow underneath the skin, yes, or within the dermis area. But the actual, what you need to look for aesthetics is a red light device, because then you directly stimulate their skin.
So that would be then at 600 level, more or less, not into the infrared, and you're not going into the deeper into the dermis or deeper into the body and the skin. So That makes sense.
Yeah.
That's good. We explain what is red light therapy and what is infrared light. So now I get it. That's perfect.
Yes. Yes. And of course, there is another effect that if you want systemic effect, if you want just feeling energized, good, look at the panels, because panels give you systemic effect. The photons coming from multiple diodes, and you're being stimulated energy systemically. And then now we can talk also about another goal. If you want to, for example, focus light into specific joints, like say joint pain, or you have the like sports injury, yes. So FlexBeam, FlexBeam, I've got it with me. It can be used around that joint, and then you bring light from being just abstract everywhere, specifically into that joint. So there is a concept. So that's another aspect of what your goal is. Second aspect is that you need to look at the quality of the diodes, because quality means everything. Same with laser diodes. Now mostly they don't use rubies anymore. They use optical diodes.
What are diodes? Are you talking about the bulbs?
Diode is a
What is a diode?
Diode. Yes, diode is a compound which actually generates light itself. So, like LED, light emitting diodes. So
okay.
it's a, well, consider it's like a bulb effectively. So it's probably my accent.
No, diode. I just didn't know the word. So now we know it's part of the bulb.
Yes.
Okay.
So there is electricity runs through it, and it creates the light itself. So and we're talking about laser diodes and LED light emitting diodes. They have difference, because laser diodes produces coherent light. Coherent light, again, new term for many people, but it basically means that the photons, they go very ordered, come out of the light source very ordered, so they follow the same pattern, and so they organized. So that means the energy which the diode generates come into their target area, very specific, without loss most of the time. But there will be some little loss, but not. It's really like very good to deliver specific point. So lasers are more targeted, more specific, and they send light to the point. And they of course very super effective. They also, when we talk about lasers, they produce quantum effects. So it's almost the whole body, when you receive energy, whole body knows there is an energy. So it's oscillation of the field is really coherent. Practically, what you need to know, that if you use lasers, they will be a source of light, and you send the beam directly to the point. Okay.
Would that be sort of if somebody's trying to do hair removal, laser hair removal? Would that be an example?
Example, yes. Another thing, if you want to like a thread veins in the veins, this vein specific. So you need to be very specific, very targeted, like a pinpoint. Yeah, lasers are very good for that. However, if you're looking to buy something which, let's say the injury, you need to cover the area. So LEDs are better at that, because LED light is distributed. They have some spatial coherence, but really considered to be non-coherent light. So light photons will be, bouncing off, going in the different directions, but overall it's going to cover the area of stimulation. So lasers nowadays, they achieve this effect by using rotating lasers, so many lasers, and they all rotate, so they target different areas. But lasers are more specific compared to LEDs. LEDs irradiate the area. So another aspect is, I would say, safety, because lasers have, especially strong lasers, possess more energy, and they deliver that energy specifically to the point. So you need to know what kind of class of laser, because the class 1, 2, it's safe, rather it's safe. But if it's 3 and 4, they can burn. So you need, as a consumer, you need to understand this and understand what you use. But of course, nowadays, manufacturers produce specifically home use lasers as well. But LEDs, they're notoriously safe. They're very, very safe because, as I said, there is no coherency. So lights may be bouncy, but at the same time, and it's spread, but it's not, it does not represent danger. So we're talking about quality of LEDs. Quality is important because LEDs could be poor quality, they don't deliver energy efficiently, or they just, you have to also know there are some LEDs are toxic. So when you dispose them, they could release, or accidentally you break it, could be very toxic. And generally speaking, I'm sort of person, I believe the cheap stuff is cheap for a reason, yes. You may be looking for something sort of mid-range or more quality, because typically value represents a quality. Not often, but typically, I would say. With FlexBeam device, for example, as a part of the co-founder, we know we made it a high top quality device. LEDs are really, really high quality device. But the price we wanted to keep low because people should be able to afford it. However, it could have been sold at the higher price, but we just wanted people to experience that. But it doesn't necessarily mean it's cheap. It's not cheap device. Okay. So I mean, and last, sorry, I'm talking a lot. Last point, people should look at the existence of the cooling sinks. Yeah. So cooling, which means the LEDs get really hot when they use. So they need to be cooled down. Tells not subconscious, but tells the consumer that it's a powerful device. Okay. So again, for the face, you don't need powerful device because you need opposite, very gently to distribute it. But if you want the body, if you want deep penetration at depth, you really want FlexBeam because with this device, the penetration depth is 10 centimeters in. So you can reach deep joints. You can reach like sciatic nerve. You can reach the knee joints, hip joints, spine, or through the abdomen, internal, like gut. We're talking about gut health. You can reach and potentiate cells there.
It's amazing. So people who are not watching the YouTube video, when she talks about having cooling system, you'll see in the device there will be little slates of where air can actually come out. So look out for that if you're looking for the powerful ones. And what about is those people are, want to go buy a cheap thing made in China from Amazon? Could it be dangerous? Could it be doing more harm than good if they don't get a good quality one?
Well, I don't know, because obviously I'm not the fan using those, but generally from science point of view, I think they're not going to get effect. That's number one. And why you buying it? It's just waste of money. If you get, of course, if you get like too powerful LEDs, you can get not LEDs like laser, for example, too powerful. Then you can get burns. Maybe they didn't meet the class. Look also regulation, because FDA exempt device, FDA cleared devices, they typically have to comply and to do lots of tests, which we actually done with FlexBeam. We've done all the tests required for FDA approval. So we meet the criteria of the manufacturing quality medical device standards. So, and if you don't see the status, again, it's a red flag to you. So maybe you may get burns. I think if you got like screwed up, or maybe you get too hot on the skin, it's also not good, because the purpose of red and infrared light to stimulate with light, not with heat.
Yeah, interesting. So, okay, we know that the FlexBeam is safe. We know that, and that one's a good. How I mean, how does FlexBeam differ from other red light therapy devices that may be of good quality in that people have heard or all that? Other than, you know, like you said, if they're made for the skin, then they're gonna maybe a mask or something. It's going to be just the red light. But you have things like the Juve, and it's different. So if people watching the video, I have both. I have a Juve Go, which you see the little slats, and you go, oh, okay, it has the slats. It has some you know, potentially good quality. I also have the FlexBeam, which I love, and I see the benefits. The Juve Go was my original, like before the FlexBeam, I even heard about it, and I'm a nomad, so I take it around with me. I don't have a big panel put in my bathroom because I travel too much, but I was always annoyed when I had a pain or something. You can't actually put this on your shoulder. I mean, at least the instructions had told me you need to stay a certain centimeters away, and that's it. And definitely don't look into the light, etc. But the FlexBeam, I can actually lay it on a shoulder, on a hip, on a knee, my butt, whatever is sore. And that to me was a game changer. It was super practical. So those are just sort of the things that I noticed just with these two devices. And I know that the Juve just has one button and that's it, and it stops at 10 minutes. Whereas the FlexBeam, we have 3 different programs as well. And that's maybe something that's a differentiation. What else do you see is the difference between this and say some other good devices out there?
You're absolutely right. I'm a big advocate to use different devices for different reasons. Like the panels are great. As we talk about systemic approach, you're right, it's difficult to put on the body, and that's why FlexBeam is ergonomic. It's you can put it around certain areas of the body, and you can also invert them. For example, treatment of the neck, you can use it in inverted way.
Because it's flexible. Yeah, it's
it's
bendy.
flexible. Yeah, bendy. You can put it on the body and you can carry on with that task you do. 3 levels, you mentioned about 3 levels of targeting. It's a part of the target. So if you want this skin level, you put on program 1. If you small joints, program 2, and deeper penetration, program 3. So it's designed this way. So designed for ease of use. But fundamentally, for us, what is important, which I think putting FlexBeam in a different category on the market, is that it's got the power. And the power is necessary. Like, I remember I described to you, and I was saying that LEDs, they are non-coherent lights. So they obviously going to lose energy. So if you create powerful device with a strong power density, this guarantees that the light actually can get to the target tissue. So power per milliwatts per square centimeter is the key. And if you have a LED device, but you have little power, it will be dissipated. It would not reach the target tissue. I think this is the key for this particular technology. And like Juve, we also put in 10-minute program, the dose, which is required to stimulate this particular area. So you could be rest assured, you don't need to calculate like some other devices, especially handheld devices. You need to know how many points you do, how many power and energy you pumping in the body. So you need to calculate how many times, how often, and how long you're going to be. So with FlexBeam, everything has been calculated. The algorithms are quite complex here, but we have done a good job for you. So don't worry. In 10 minutes, you receive a dose. So you don't need to keep treating the same area. You just can use on other areas. So power and the dose in the device is, I think, from know-how and clinical efficiency, this is the key for me. But of course, ease of use, it's very convenient. Yes, the fact that you can charge it and take away with you on a trip, and just 7 treatments, 10 treatments you can get out of it on one charge. So I think that's another appealing factor, right?
Mm-hmm. It is. Yeah, it is. And that fits in my suitcase. So that's okay for me. Definitely. And I do travel with it. So I've been really excited about it. I'm a fan. And I mean, I like them both. I mean, I can say they just have they're different things, you know, when I'm brushing my teeth and instead of having at night, instead of having the dark light in the bathroom or bright light in the bathroom, I would just turn on the panel because then it just gets this nice little glow. Maybe I'm getting a little bit of collagen, I don't know, but when I want something really effective for a pain, then I would definitely, it's so much easier to do the FlexBeam. So one thing, I just have a really quick question about these devices. How does it differ? I mean, I know that when we get into a sunset or sunrise, you know, we have that red light, and of course, yeah, like you said, it's convenient. You know, we can't always go into a sunset or sunrise, and especially if you're living in a city and there's buildings and stuff. So that I get. But imagine if you could, if somebody is living near the beach, and they want to go out every day at kind of, you know, for the sunset or sunrise, how different would like, because it sounds like FlexBeam is very targeted, like you can literally put it on your body, whereas you're just getting the light from the sun. Is there a huge difference there, or is just some crossover? What is the difference?
Yeah, you know, I have been asked that question before by someone, and also the guy said, well, might as well I just be in the sun. Yes, you could be in the sun, but consider FlexBeam to be like 10 times more potent. What you get from the sun, it's really a lot stronger, more compact, and it focused on that specific point of your body. So it would then create what we're looking for, some clinical efficiency. Generally speaking, if you just want general energy or relaxation, or let's say you want to optimize your immune system, there are certain parts on the body you can target. And so, again, like you said, if you're out in the sun, you receive all of it nicely and gently. But if you, again, want more powerful effects, then you target these specific areas, you put FlexBeam, and it delivers potent stimulation to the area.
Yeah, that makes sense. And you can only expose your skin to the sun certain times of the year, because half the time I'm wearing all my clothes and the other half maybe not. But it's just, yeah, it makes it much more convenient to have a device. So let's now focus on women, on women going through menopause. You know, sometimes we age, we start to have more aches and pains and injuries. How can red light therapy resolve these issues? Like, and does it work the same for everyone in every type of case?
Yes, I definitely would recommend women to use it for postmenopausal, even perimenopausal time. Because number one, what you get with red light or near-infrared light is stimulation of mitochondria. Mitochondria in every cell is ultimate rejuvenation, like absolutely no kidding. Because let's say skin cells, you have cells of the heart, cells of the gut, cells of the muscle, cells of the ligament. So whenever you place in the device, those cells will receive stimulation and their energy processes will be working at optimum. To me, this is a prevention. To me, this another thing is with we're going to stimulate with near-infrared light, which is now by few scientists, physiologists, scientists have been identified as a powerful antioxidant. So what does it mean for aging? Cellular level, the cell becomes old when it's stuffed with oxidative stress. Yes, oxidative molecules which create oxidative stress. So what they found that under near-infrared light, specifically between 800 to 850 nanometers, what you're going to get, you stimulate clearings of that reactive oxygen species. So you actually clear from toxins, each cells where you stimulate, and at the same time, you optimize energy process. I mean, how amazing is that? So whether you want to target specific area, aches and pains, like you said, That one aspect, yes, you can. Another thing, we women, postmenopausal women, we want to go and exercise, yes, at more potential. So if you use, for example, FlexBeam or any red and infrared light devices, what you're gonna get is your workout will be better. You push more, you run farther. You basically get out of your workout a lot more. So again, you optimize your energy processes in the body and prevent you from oxidative stress. And lastly, remember we talked at the beginning about effects of melatonin, pineal melatonin or subcellular melatonin. They both have they have impact on the circulating circadian rhythm. And guess what? Circadian rhythm is controlled by melatonin, but every hormone released at a certain time on this body clock, yes? So if we have shifted estrogen, shifted progesterone release, and we start using this red light, which then help with the regulation of this timing, we can actually get our body more youthful. And so that aspect should be also looked at.
Oh, wow. I like that. I did notice, yeah, the sleep one big difference I think with the Juve that I have and the FlexBeam is that when I got the Juve, there was no customer support or anything going on. Whereas with the FlexBeam, you invited me to sessions, that group sessions to learn more about the FlexBeam and how to use it. And I was just kind of putting it on my hip every day. And then I realized, wow, no, you don't just put on the hip. You explained how you put it in different areas, and then you don't do it every day. Because here I am thinking, oh, if I do it, if it's good for me, the more, the better. That's just the way we think. And in fact, no. And that guidance is so important. I had no idea what to do with the other devices. So I really, really appreciate that. That's one big, big thing. And I do notice, because you then eventually told me, no, you take a break, that the sleep is not as good as when I do the FlexBeam. And so, and I usually do them at night. I think when you said to energize the cells, I don't know if maybe you should do it in the morning to have a good workout, but I take it at night, and I do it simultaneously with, I listen to a book on audio, or I listen to meditation, or, even I'll go on my phone and do some text or something with my blue blocking goggles or something. But I do have that relaxing moment, and it's a 10-minute session, but then I have 3 or 4 different spaces. So it's about a 30-40 minute meditation session or relaxation. And the device is really warm. It's soft. And I mentioned this to you before in our group that I've actually fallen asleep on it because it's just so calming and relaxing, and that, just me off to sleep as well. So I do see the benefits now. I didn't even think about talking about sleep in this podcast, but you're absolutely right. And especially women going through the menopause experience do have a lot of sleep disruptions. So that can help.
Yeah.
So let's talk about a little bit about the skin, and we've got maybe 5 more minutes, because we're concerned about our wrinkles or droopy skin, and thanks to the loss of collagen, this is all happening. Some of us are seeing aging spots or dull skin. And how can red light therapy help improve our skin? And does it really boost the collagen? And if it does, like by how much compared to, like, say, a collagen supplement or a derma filler? And then when do you see the results with some of these devices? And with the FlexBeam too, because I need to learn that too, how to use it on my face.
Yes, FlexBeam actually designed more for the body, but once you have the device, you can use it for face, and I will tell you in the end. But let's talk about the benefits. So research is there. Quite a few good quality dermatological research talking about aspects, impact on acne, impact on aging skin itself, so improve collagen production, improves the tone of the skin, age spots, and particularly, sun damage. It counterbalances the sun damage. In addition, what you need to look as well, vitiligo. I read even that it's helpful with vitiligo, which is a rare thing, but in dermatology, it's difficult because not many things work on it.
That's when your skin turns white, or you like white patches, right?
Yeah, losing pigment, and it's quite dangerous because pigment is for reasons, so it protects us from getting skin cancer. So people become like that. Different devices do differently. You need to look at what manufacturer is defined as a use, for how often. Generally, I would say any kind of device, use it as a course of treatments, okay? Because then you potentiate session after session, but then you need to make a break. And you absolutely correctly noticed that it is important to introduce a break, because if you carry on in photobiomodulation, what is happening, you have so-called Anschutz law or biphasic dose response, where suddenly you stop receiving effectiveness from the treatment if you do too much. So I know we all want looking great, but step by step, just do it as a bulk of treatments, rest, like maybe 10 days or 3 weeks maximum, and then you must have a break. And then after the break, you can resume again. Break, I don't know, a week, 2 weeks, even months you could do, and then you carry on again. Again, it's depend on the what sort of device and what light, what dose, but the manufacturer should be able to give you some indication of the use of the device. With the FlexBeam, our recommendation is to use the shielding of the eyes, the goggles, because remember, our LEDs are very, very potent, very strong, and use it at the distance of the reading book. Program one is good, because then light receive a very gentle stimulation. What I know from science of red light therapy, the collagen produced better in quality and in quantity. So collagen, for example, one produced a lot sooner, and one is a lot stronger and elastic. But there is also one effect we never had a chance to talk and discuss about, impact on water molecules as well. So because of the near infrared lights, it would already start affecting water molecules. So water molecules are important for the skin because they lubricate collagen. Yes. And if collagen is not lubricated, it's become like sagging, like an old elastic. But you want that bouncy effect. Yes. So it needs to be lubricated. So, but the water inside our human body exists in a states, they call it fourth phase of water. Dr. Pollack talks about it, which is polarized. Yes. So the water molecules become charged positive one and negative on the other. So it helps to create the more of the charge over the collagen. And that is also important because then you have much life charge, energetic and moisturized collagen inside your body. And red light therapy does it all. It has impact on water, it has impact on collagen, it has impact on elastin. It also stimulates microcirculation in the dermis. So the exchange with a much better oxygenated blood happens. So it's feeding your skin from inside. And when you use topical stuff, yes, use it, of course. Compared to fillers and other things, I wouldn't know. We have not done studies to compare them both. But my guess is when you use red light, you evenly stimulate all the skin, including hair, you stimulate as well. So because the photons are all around you and all getting into your body, I think it's much more preserve your natural look. Whether with fillers, you just have some parts of the face and may not give you that natural look. This is my take anyway.
I remember when you said, when we had this group meeting trying to learn a bit more about the FlexBeam, and there was this woman who was mentioning how she had the device on her neck to, I don't know, maybe she had a stress or strain there. and her hair started to grow. And her hair started to have these little baby hairs and hair growth. I mean, I completely unexpected. That's not what was her goal, but I can see now based on what you just told me. Yeah, it's quite systemic, and you can get a lot of benefits. Okay, let's leave the last question, because I know you got to go. So healing the gut, gut problems. I'm worried about, women who are going through midlife. They may have leaky gut or irritable bowel syndrome, Crohn's disease, maybe just bloating or poor digestion and some spasms. Can red light therapy really help with this?
I absolutely believe so. Just talking about this hair growth, hair bulbs, it linked to your gut health, believe me or not, gut health. So if you have problem with microbiome, the hair follicles are also experience the same. It's like microsystem within the whole macrosystem. So you do need to address the gut. Yeah, absolutely for that. It's important to understand that the gut area, our intestine, our large intestine, small intestine, basically our pharmacy of the body. So we generate everything there. We generate enzymes, we generate our neuropeptides, neurotransmitters. Everything is coming from the food you eat and transforms into your own body compounds. Yes. So what is the latest research show? The latest research show that this microbiome, this important bacteria which helps this process, is light sensitive. Light sensitive. So you could a good quality bacteria, which now we all lacking because of the environmental damage we receive through pesticides in the food industry, like all this augmented foods and lots of packaging and everything, is all impacting our gut. So you want a good microbiome, good bacteria more in our gut. So if you stimulate with light, what you give energy to the cells, plus you're going to improve microbiome as well. Again, this is very latest research, literally last 2 years. You see explosion of the research papers in this area. I like to use it over the liver, because our liver also gets hammered, with the lifestyle stress, and people also take lots of medication nowadays. So they have to help liver, kidneys, spleen. So I would not just use the gut, but I would use those for sure, because they all contribute to one process: absorption, creation of food, and elimination of the food. So and elimination of the process. So, but ultimately, you talk about this spasm, bloating, and everything. Again, we know it affects muscular cells. We know it gives charged stimulation for muscle to repolarize and relax. And when muscles relax, you don't have spasm in the stomach. And then as a result of it, you have less pains and better digestion. Why not to use it? I would also use in conjunction of treating the spine, lumbosacral parts of the spine. In my clinical practice, over 25 years, what I learned one thing: it's never isolated. When people have back problems, they inevitably develop the gut problem, because innervation for the gut comes from the spine. So if you apply FlexBeam to the spine, applied to the abdomen, then you're going to get real results and resolution of your problems.
It's amazing. So we can use the FlexBeam, for example. I noticed, I haven't used it for gut issues. I don't have those yet, but I understand you put it on your abdomen, your back, like you said, different parts of the body. When would somebody start to see results, like with their gut issues? Is it immediate in the first treatment, or do they need several weeks?
Most of the time, several weeks, because typically what you see good, result immediately if you have something really fresh, like it happened yesterday, day before yesterday, something like, when you done exercise, overdone exercise, or you have an injury. But when you talk about gut health, let's face it, it's always some kind of accumulative. abuse on our
Mhm.
digestive system, yes, or maybe the injury gradually caused deterioration linking to the gut problem. So anything is typically chronic. So I would say expect, use FlexBeam for about 2 months. Within 2 months, you should be able to see the difference. If not, I'm happy to help people to navigate because most of the time people get results, but sometimes they don't because, there could be comorbidities, some other conditions. There could be some, everybody is different. So I normally work with healthcare practitioners to help to optimize or create a protocol specific. We're here to help.
That I don't know comes with any other device. That to me is one of the most valuable things or parts about FlexBeam is that we have you to ask and to help. I don't know how you find the time, but these group sessions have been so helpful, and I really encourage people, like, you have someone there to hold your hand to help you figure this all out, because it's not just put it on your gut and then tomorrow you're gonna feel better. So I really appreciate that. I mean, that's just huge for me. So yeah, is there anything else you'd like to say before I move on to the cost?
I just want to say that red light therapy, infrared light therapy, all of it is really amazing and very promising field, developing field in medicine and developing field in recovery of sport injuries. So guys, please check it out, look for the research and reach out if you want to learn more. But I sincerely believe it's really beneficial. It creates that environment for you to better heal and feel at optimal self. Take control of your own recovery. Take charge of it.
Oh, it's amazing. Yeah, thank you. I'm sure people are going, oh, I want the FlexBeam, and how much does it cost? Or we have, well, I know you do have special offers as well, but we do have a discount code on top of it. But I'm just, because I see it fluctuate between like 450 and 650, depending if there's a promotion or not. Is that correct?
Yes, that's correct. Yes, I have seen this. But just rough idea, we wanted you to be able to afford it. So look out for you're gonna have promotions with Zora's today. Please, you can act on that.
So we're going to get this podcast out May 1st, and we've got 1 week of a special offer of $50 off with the code ZORA, ZORA, and that's only going to last until April 8th, just 1 week. So if you're interested, go get it now. And then after that, you can still use the code ZORA and you're going to have $30 off. So you can go to the website recharge.health, or you can just Google FlexBeam and you can find that. I have links to their Instagram, YouTube, Facebook, and their LinkedIn accounts. And we can always connect you with Dr. Zulia if you have more questions. So thank you so much. Is there any last words for a woman going through menopause?
Yes, because you can always stay at your useful self. You can always look fabulous, but please use, what you normally do: good food, exercise, beautiful photobiomodulation device, and most of all, healthy thoughts, positive, healthy attitude in life.
Great advice. Thank you so much. And I will see you at the next meetup. Take care.
Thank you so much, Zora. I really appreciate you working with me today, asking these interesting questions. I thank you for being a great host. Thank you so much.